A key factor in who will live and who will die from the coronavirus is the number of intensive care beds, especially the number of ventilators. Prime Minister, do you have a plan to at least double the number of intensive care units and secure the ventilators we need? And if there is such a plan, when will this goal be achieved?
The Prime Minister.
Thank you. I'll make a brief comment and pass on to the Minister for Health. The modelling work that is being done to provide advice to the government and to the other Australian governments is to ensure that we seek to manage the spread of this virus in such a way as that it will avoid what would otherwise be quite intensive peak demands. I think we all understand that. So the first line of attack in this is the social distancing and other measures that will significantly alleviate the pressure on the health system. And that is the first thing we need to do. But what we have done in putting those modelling processes together is to look at the potential impact on what the effect will be on those intensive care units, but also emergency departments and other parts of the health system. And that will mean ensuring that we maintain medical supplies and we also manage the health workforce within the hospitals that can best ensure that those beds and services are there when they need it. We, at this point, have a very low number of patients that are actually in ICU, but of course we expect that to change as things change with the spread of the virus in the future. But I'll ask the Health Minister to add further on respirators and other matters of that nature.
The Minister for Health.
Thank you very much, Prime Minister, and also to the member for Melbourne. As the Prime Minister said, there are two parts to the strategy. One is to reduce the demand, or to flatten the curve, as is now a phrase that is all too sadly familiar to Australians as well as everybody in this chamber. That's about reducing the number of people who contract coronavirus and spreading the load whilst protecting the vulnerable. At the same time, since the very earliest times, when the Chief Medical Officer declared this to be a disease of human pandemic potential on the 21st of January, he and the State Chief Health Officers, the State Ministers, and I want to thank all of the State Ministers, their health services are doing an extraordinary job. I particularly want to thank New South Wales Health and the New South Wales Minister, Brad Hazzard. They have borne the brunt of this and they have done a Herculean job. And all of the leaders have been focusing on this. It's been one of the key elements, and normally we wouldn't say this, in the National Security Committee requests that the Prime Minister has made to compare peak demand with peak supply. We are seeking to double the capacity of intensive care units, if not more, including ventilators. I can inform the House that there has been a major order for an extra 1,000 ventilators, what are called invasive ventilators, placed with ResMed. Non-invasive ventilators are now being determined by the AHPPC requirements, and 4 firms have stepped in to help with production: ResMed, GE, Philips, Medtronic. They are showing a spirit which is beyond what any of us could have hoped. We thank them, we honour them, we will work with them.